Today's World Insight. WHO declaration of a global pandemic, what it means and what happens next, in the words of the WHO spokesperson. And a Wuhan doctor who survived COVID-19 talks about coping with ICU life, and a ballerina's business struggles, how she survived outbreaks. Here is our host, Tian Wei.
Hello and welcome to World Insight from Beijing. I'm Tian Wei. Rising numbers of confirmed COVID-19 cases worldwide prompted the World Health Organization to declare a pandemic. The WHO Director General said the agency is keeping an eye on the outbreak around the clock. It is deeply concerned both by the alarming level of spread and severity and by the alarming levels of inaction. On Wednesday, U.S. President Donald Trump announced the U.S. will suspend all travel from Europe to the U.S. for the next 30 days, starting Friday. Italy has declared a national lockdown. It's ordered bars and restaurants to close after a swell in deaths, more than any country since the outbreak began. Are these measures aggressive enough? What more does the international community need to do when it is a pandemic? Earlier, I talked to Tarik Jasarevic, the spokesperson for the World Health Organization. Let's hear this interview from him. For more on the COVID-19 pandemic, as announced by the WHO, joining us from Geneva is Tarik Jasarevic, spokesperson of the WHO, the World Health Organization. Mr. Jasarevic, welcome to our program.
Thank you.
I know you are extremely busy today because of this big announcement, but let me ask you about this. Why it took so long for WHO from a health emergency to a pandemic? Some have been blaming WHO for not reacting fast.
Under international health regulations, and this is a document that has been agreed by all countries in the world, and this is a guiding document when it comes to global health security, there is only one category, and that's public health emergency of international concern. So this document, this status has been declared on January 30th. So that's the only category we have under IHR, and that's our highest level of alert. So WHO has declared global health emergency on January 30th. Yesterday, Director General simply described the situation as being pandemic. But that in any way does not change what WHO is doing. It doesn't change our advice at all. In fact, it's just strengthening our arguments when we are saying to countries around the world what they should be doing.
Right.
So in a way, pandemic, when we use the word pandemic, we are just describing or characterizing the situation, but WHO has declared global health emergency end of January.
I see. If you look at the situation from January, when public health emergency has been announced, to now, which is being described as a pandemic situation, what have changed?
We have more 90% of cases are basically coming from 4 countries. So even though more than 110 countries have reported cases, huge majority are only in 4 countries. That's China, Iran, South Korea, and Italy. But when we look at the spread of the virus, we see that really the major portion of the world is or will likely be exposed to the virus. And this led really to this qualification of being in pandemic situation. However, it is uneven, and however, we are trying really to divide countries in 4 groups. That's what we call 4C. Countries with no cases, countries with sporadic cases, countries with a small cluster of cases, and countries with a community transmission. The advice and the actions that countries will do will really depend in which category they are. Now, this is a big test for everyone. It's not a time to blame anyone. Just as we were saying when people were talking about China, that it's not a time to look for who did what wrong, but to work together, try to find solutions together. When we look, there will be a time when we will be seeing this pandemic from far away and trying to learn lessons, but in the meantime, we really have to look for the solutions. And we see that countries around the world try really to see how best they can protect their citizens depending on their situation. Obviously, it's not the same case if you have 1 or 2 people who have been infected with COVID-19, or if you have thousands of people who are in hospitals. So countries are trying hard, we know that.
Yeah.
But maybe we could do all more, and countries should really not leave this response to health ministries and only to health workers. Response has to come from all levels of government. And this is what we are trying to say, that health workers in any country in the world are risking their lives, their health, and often do not have enough of material, enough of training, and we need to help them. And population need to help in a way that they will adopt behavior that will reduce the risk, that they will go to hospitals when it's needed, and governments have to make measures that are proportional to the risk.
What about the next layer?
First, we don't really know what will happen next, and we prefer not to do predictions from our side, but rather to focus on solutions. And what we are saying to every country, please still do containment measures. It is much easier to deal when you have a few cases rather than you have thousands of cases. And when you have few cases, it is important to go to try to find the virus itself. Get the people who are sick, isolate them, provide them with a medical treatment, look who those close contacts are, make sure that they do not infect other people in case they got the virus. But we have seen what countries like China, South Korea or Singapore have done, and they have done very strong basic public health actions in terms of epidemiological surveillance, and that's basically finding people who are infected, testing them, treating them, looking for their close contacts. You may consider cancelling gatherings, but those measures have a social cost. It's disruptive to the social life. So there is no blanket recommendation from WHO, but it is to say containment measures do work, try to limit the number of infections, at the same time try to see how you will reduce potential risk for others.
So it has to be a tailored approach up to every entity's own decision. Now, how would you say should be the role of political leadership, economic leadership, societal leadership in terms of their support to get the public and also different places around the world onto the right track at this moment? This is already a very critical moment.
Governments have to invest all the resources they have in protecting their population. Health systems obviously need to get to the level of readiness that they can quickly detect, treat, test everyone, and at the same time work in a strengthening health system so they can cope with a bigger number of cases. But we should not forget, population has a very important role to play. We cannot do this without any citizen really playing its part, first of all in adopting a behavior that will reduce the risk of infecting others. And that's basic hand hygiene. It is basically if person is sick, coughing, having a temperature and is in an area where virus is circulating, not to go out, not to take the train or plane, but to stay home for a couple of weeks and contact by phone.
Last question, very briefly from you. From last time we were talking to one another, Dr. Jasarevic, to now, where is China? What China should do well next in order to make sure the quote-unquote containment can be successful eventually?
You have heard the WHO in past weeks saying loudly to everyone that there is something to be learned from China. China put in place very strong public health measures that were certainly very difficult to live for people of Wuhan and other cities, but through those measures we were able to see declining number of new infections in China. And this basically shows to all of us that this pandemic can be controlled and can be fought against. So we should not give up. Now, obviously, it is important to keep strengthening health system, we never know how this virus can go. It's a new virus, and we have seen in the past with other diseases, with other outbreaks, that epidemiological curve can go up and down. You can have setbacks easily. And that can happen anywhere. Yeah. So it is important to remain ready, to continue to do epidemiological surveillance and public health measures, and basically try to show that to others who are just starting to be in that situation where China was months ago.
Okay. Tarik Jasarevic, spokesperson for the World Health Organization. Thank you so much, sir, for taking your time out of your extremely busy schedule today. Really appreciate it.